Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be going over part 2 of infection control. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. So go ahead and press that like button now so you don't forget. Subscribing to my channel, please subscribe if you haven't done so already. And don't forget, I'm now offering next generation NCLEX review sessions. I'm offering next generation NCLEX review sessions, one-on-one tutoring sessions, and private coaching or consultation sessions. You can reserve your spot by going to my website, nexusnursinginstitute.com. If you're a current nursing student and you are struggling in the program, you have to have a really high grade for your next exam, be sure to check out the audio lessons. The audio lessons, I created them specifically for the students that are currently in the nursing program because there are certain key things. It doesn't matter which nursing program you're in the country, there are certain things you absolutely have to know. It's most likely going to be on your exam. So I cover those topics. Again, check me out at nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms on TikTok, Instagram, and Facebook. All right, guys, so let's get started. Let's take a list. Let's take a look. And we're going to get started by looking at the modes of transmission. We have contact, indirect, droplet, airborne, vehicles, and vector. If you are new to my channel, when I do these types of lectures and I teach from the book, anything that I have highlighted, especially if I have a star next to it, I have it underlined, that means it's important to know, pay special attention. And sometimes I'll even, put red flags for you. Look, I'll say, no, that means you need to know this. And I'll even tell you where you're most likely to see it, either HESI, NCLEX, ATI, or combination of them, okay? So anyway, modes of transmission. How are these pathogens transmitted? First one is direct. Direct is person to person, either by the fecal or the oral route, physical contact between source and susceptible agents, such as touching the patient's stool and then touching their inner mouth or consuming contaminated food. The person who prepared the food didn't wash their hands, and guess what? Now you're eating that food, that nasty food, right? Indirect. Personal contact of susceptible hosts, look at this, with contaminated inanimate objects such as needles, sharps, dressings. Droplet precautions. I highlighted droplet precautions. I put a star next to droplet precautions. I'm saying droplet precautions, but droplets actually, which is a mode of transmission. So I didn't mean precaution, but just droplet. This is important for you to know. This is seen very often on exams. So for droplets, what's important for you to know? Large particles that travel up to 3 feet during coughing, sneezing, or talking, and they come in contact with a susceptible host. I circled 3 feet. These particles are large. They can't travel that far, but they can travel up to 3 feet. Airborne. These are much smaller particles, okay? Droplet nuclei residue or evaporated droplets suspended in the air. Why can they stay suspended in the air? Because they're so much smaller, okay? They can stay suspended in the air for hours. That means if the person has this infection, they cough or sneeze on the subway, and they walk off of that train, guess what? Those droplets can stay suspended in the air for hours. So somebody can come after them. Many people can come after them. They breathe it in, and now they're infected, okay? So droplet, much larger, more than 5, airborne, much smaller, less than 5. Next, vehicles, and in parentheses, I put inanimate objects, so just so you know. Vehicles, contaminated items, water, drugs, solutions, blood, food. And last, vector. Examples, mosquito, louse, flea, tick, okay? Let's keep going. I'm right here. Let's talk about the difference between localized infections versus systemic infections. This is important. You have to know the difference. So when an infection is localized, it's in one area, it's affecting one organ, versus when it's systemic, it's all over the body, right? So let's talk about localized first. If an infection is localized, and up here I wrote unilateral, so it's not going to be on both sides of the body, it's localized to one particular area, okay? If an infection is localized, such as a wound infection, right? A patient usually experiences localized symptoms. You need to know these symptoms. What are they? Pain, tenderness, warmth, redness. Where? At the wound site. They're not going to feel it all over because it's localized. So all of those symptoms are going to be at that site. You're going to use standard precautions, appropriate PPE, of course, hand hygiene when assessing the wound. Guys, the number one way to prevent the transmission of infection is always going to be hand hygiene, okay? An infection that affects the entire body instead of just a single organ, like instead of just the skin or one area, this is what's known as systemic, and that can be fatal. It can be deadly if it's undetected and untreated. And look what I wrote down here for systemic. Bilateral, the patient will have general symptoms. They'll feel it all over on both sides of the body. Let's keep going. The nurse is responsible for properly administering antibiotics, monitoring the response to drug therapy, using hand hygiene, and standard precautions. Let's move on. Okay, let's take a look at box 29.2. Look what it says here. Course of infection by stage. You have 4 stages. Professor D, do I need to know those 4 stages? Of course you do. Oh, did my camera just freeze? I'll be right back. I have to fix this, guys. My camera froze. Okay, guys, I'm back. As I was saying, you absolutely need to know this, and you know that because look what I put right here, no, with a big old exclamation mark. So let's go over those 4 stages. These are the courses of infection by stage. So the first one is the incubation period. This is the time in between. So it's the interval between the entrance of that pathogen, that virus, that fungus, whatever it is, into the body, the time between the time it takes from the time it enters the body to the appearance of the first symptom. So for example, chickenpox, 14 to 16 days after exposure, common cold, 1 to 2 days, influenza, 1 to 4 days, measles, 10 to 12 days, mumps, 16 to 18 days. Don't be so hung up on the days. Make sure you know what the incubation period, what that means. Okay, it's the interval between the entrance of the pathogen into the body and the appearance of those first signs and symptoms of infection that the patient has. 2, prodromal stage. That's the interval from the onset of non-specific symptoms, non-specific signs and symptoms such as malaise, low-grade fever, fatigue, which can be, it can be attributed to a lot of things, to more specific symptoms where the patient has a specific symptom, such as something like, okay, nuchal rigidity, right? There are too many diseases or disorders that have nuchal rigidity. So patient has nuchal rigidity. If they have it along with fever, what are you going to be thinking of? You're going to be thinking of, oh my gosh, what are you going to be? Meningitis, right? All right. 3, illness stage. This is the interval when the patient manifests signs and symptoms specific to the type of infection. For example, strep throat is manifested by sore throat, pain, swelling. Mumps is manifested by high fever, parotid, and salivary gland swelling. By the way, for mumps, this is a famous test question. Make sure you know these symptoms for the mumps. The high fever, parotid, especially the parotid and salivary gland swelling. And then last is the convalescent stage. That's the interval when the acute symptoms of infection go away. They disappear. Let's talk about, wait, I have something pointed up here. Okay, we'll talk about that later. Let's talk about normal flora. Normal flora is good. We give normal flora a thumbs up. Normal flora do not usually cause disease when residing in their usual area of the body, but instead participate in maintaining health. What did I write here on the side? I wrote example normal flora of the vagina. So the vagina has normal flora. Normal flora are the microorganisms that are found in the body, but they're good microorganisms. They keep, other pathogens in check. So you have normal flora of the vagina, which is good. You get rid of that normal flora by using soap and things like that. You cause what? A yeast infection. All right. The natural normal flora that is found in the vagina keeps a yeast from growing. You have a normal flora of your mouth. If the patient's taking antibiotics, especially liquid antibiotics, and they get rid of that normal flora in the mouth, what do they get? Thrush. So normal flora is a good thing. These are microorganisms, again, that reside, in the body, and they actually keep the pathogens in check. Now, let's scroll down here to where it says broad spectrum antibiotics. The use of broad spectrum antibiotics for treatment of infection can lead to superinfection. Broad spectrum antibiotics, guys, they kill everything. Gram negative, gram positive, everything's got to go, right? They're not specific. They can lead to superinfection. Superinfection develops when broad spectrum antibiotics eliminates a wide range of normal flora organisms. Remember, normal flora is good. So if a patient's getting a broad spectrum antibiotic, they're getting antibiotics that are killing everything under the sun. It's also going to kill the normal flora, and it can cause the patient to have a superinfection. When normal bacterial floras are eliminated, the body defenses are reduced, and it allows disease-producing microorganisms to multiply and cause illness. An example I gave you guys was, such as a thrush. Let's talk about body system defenses. I'm down here. The airways are lined with moist mucous membranes and hair-like projections or cilia. You guys learned about cilia in A and P. They help to move things along, right? They help to get rid of those pathogens. That, look what it says, rhythmically beat to move mucus or cellular debris up to the pharynx so the patient can cough it up, or it can be swallowed. But the point is, it can get expelled. Now, next, let's talk about inflammation. Inflammation is important. We're right up here where it says inflammation. Let me make this a little bit bigger for you. Inflammation, the cellular response of the body to injury, infection, or irritation. This is what's known as inflammation. Your body's going to try to survive no matter what. Signs of localized inflammation include, Professor D, do I need to know these signs? Absolutely. Make sure you know them. Swelling, redness, heat, pain, tenderness, and loss of function in the affected body part. When inflammation becomes systemic, because those symptoms we just looked at, this was localized, right? We saw this on the page before. Now we're seeing it again. Other signs and symptoms develop, including fever, increased WBCs, malaise, anorexia, nausea, vomiting, lymph node enlargement, or organ failure. Make sure you know the difference between localized and systemic infections and the signs and symptoms of both, okay? Notice I got stars next to all three: inflammation, your localized signs of infection, and your systemic signs of infection. And take a look at what I wrote up here. It says HESI, no difference between local and systemic. This has been seen on HESI over and over and over again. Don't say I didn't warn you. Let's keep going. Right here, it says inflammatory response includes a vascular and cellular response formation of inflammatory exudates. And when they say exudates, they're talking about fluid and cells that are discharged from cells or blood cells, pus or serum, and tissue repair. Whenever there is damage, wherever there is trauma, guess what? The fluids, electrolytes, blood is going to rush to that site of damage or trauma. That's why you see swelling, because the WBCs are rushing to the area to save the day, fluids rushing to the area to save the day, blood that carries, the RBCs, which carry hemoglobin, the hemoglobin, which carries oxygen, is rushing to the site of trauma or infection along with the WBCs. Platelets are rushing along to make sure you don't bleed out, right? Everybody wants to save the day. So all of these fluids and electrolytes and blood that rushes to the area where there's trauma or inflammation, or not inflammation, trauma or infection, they're going to rush to that site. They're going to cause what? Swelling. Look at this. The accumulation of fluid appears localized as swelling. Swelling is known as what? Edema. Another sign of inflammation is pain, which is caused by the swelling of inflamed tissues that increases pressure on the nerve endings. All of that fluid, all of that blood, all of those electrolytes, everything rushing to that one area, what do you think is going to happen to that tissue? That tissue is going to stretch. That tissue is going to put pressure on the nerves, and that pressure on the nerves is what's going to cause the patient to have pain. Let's keep going. I'm right down here. The cellular response of inflammation involves WBCs arriving at the site. Remember, the WBCs are helpers. They help fight infection. They're part of what? The blood. Through the process of phagocytosis, specialized WBCs called neutrophils and monocytes, those are type of WBCs, they ingest and destroy microorganisms and other small particles through the process known as phagocytosis, okay? You guys learned about that in A&P. If inflammation becomes systemic, oh my gosh, so now this inflammation, it's not only localized, it's all over. It's become systemic. Other signs and symptoms develop. Leukocytosis, or an increase in the number of circulating WBCs, is the response of the body to WBCs leaving the vessels. They're trying to go help. In the adult, a serum WBC count is normally between 5 to 10,000, but typically it rises between 15 to 20,000 or even higher during inflammation. But your normal range is 5 to 10,000. Let's keep going. Fever is caused by phagocytic release of pyrogens from bacterial cells, which causes a rise in the hypothalamic set point. Remember, the hypothalamus is responsible for what? Temperature regulation. Don't forget everything you guys learned in A&P, because it all comes back to bite you in the butt if you didn't learn it the first time around. Okay, let's talk about exudate. Inflammatory exudate, so accumulation of fluid, dead tissue cells, remember this phagocytosis happening, and WBC forms an exudate at the site of inflammation. Exudate may be serous, that's when it's clear, like plasma, sanguinous, containing red blood cells, or purulent. Purulent is bad, guys. That means infection containing WBCs and bacteria. Usually the exudate is cleared away through lymphatic drainage. Let's talk about tissue repair. At the bottom of the page, look at what it says. Inflammation is chronic. If inflammation is chronic, tissue defects sometimes fill with fragile granulation tissue. Let me move this over. Granulation tissue that eventually takes the form of a scar at the completion of the healing process. The scars surrounding the tissues are not as strong as the normal tissue, and it may be more susceptible to injury from pressure or shear or friction, which increases the risk of pressure ulcer development. Now, part 3, we're going to talk about healthcare associated infections, but I want to go over one more thing. I want to go over this table with you. Take a look. Some very important things on this table that I want you guys to know. Now, this table is going over natural defense mechanisms against infection. I'm not going to go over all of them, okay? You guys can pause to read on your own. Make sure you know all of them. I don't write your exams, but I will go over the most important ones you need to know. Let's start with the skin. Let me make this a little bit bigger for you. So, the action of the skin. Why is the skin so important? The skin is your first line of defense. The skin is your first line of defense. It is the barrier to microorganisms, and that's why it's so important for the skin to remain intact. Why do you think patients who are, for example, burn victims, burn patients, one of the things we are most concerned about is infection, because their first line of defense is gone. Factors that can alter the defense mechanisms of the skin: cuts, abrasions, punctures, wounds, macerations. And on the side, look what I wrote. Let me move this over for you. I put opening skin, anything that causes a disruption in the patient's skin integrity. Okay. Next, for skin shedding of the outer layer of skin, factors that can affect, alter the defense mechanisms: improper hand washing technique, excessive bathing. Excessive bathing, guys, can cause the skin, and I know it sounds weird because when you bathe a lot, you're using water, right? Water is moist, water is wet, but excessive bathing can cause a drying of the skin, that can cause cracking of the skin, that can cause disruption of the skin integrity. Let's talk about the mouth. Factors that can alter defense mechanisms of the mouth: laceration, trauma, extracted teeth. That's why patients who are immunocompromised, if they're going to have a dental procedure, very often they're going to what? They're going to be placed on antibiotics. Oral hygiene is very, very, very important. Let's move down to the respiratory tract. Smoking. Not humidifying oxygen. If patient's going to be on oxygen for any extended amount of time, that oxygen needs to be humidified, because if not, it's going to cause dryness, which can cause cracking, which can cause what? Infection. Moving on. Macrophages. What do the macrophages do? They engulf and they destroy microorganisms that reach the lungs, reach the alveoli of the lungs. Remember, guys, the alveoli, that's where gas exchange takes place. What can alter that defense mechanism? Smoking. Let's go down to the gastrointestinal tract. GI. Look at what can alter the defense mechanism for GI tract. Administration of antacids. Remember, the GI tract, the gastric secretions, hydrochloric acid, all of this is what? Very acidic, and that acidic environment prevents the growth of bacteria or even the retainment of bacteria. Bacteria does not like acidic environments. So that acidic environment helps protect the patient. So what can alter that? Administration of antacids, because what do antacids do? It's very important. Make sure you guys know the action of antacids. Antacids does exactly what it's called: ant against acid, right? So what antacids do, they neutralize the gastric acidity. And so it promotes a great environment for the bacteria to actually thrive and to grow. So we don't like antacids when it comes to infection. What about rapid peristalsis of the intestine? Why is rapid peristalsis of the intestine a good thing? Because anything, any microorganisms, any fluid, anything that just sits still, it's a great environment, a great medium for bacteria to grow. Look what I wrote here, right here. Look what I wrote. Anything that does not move, you're giving it a chance for bacteria to grow. So when there's rapid peristalsis, even if there was bacteria, it doesn't even have a chance to grow. It's going right through the GI tract, and the patient has a bowel movement and out it goes, right? It doesn't have a chance to sit there and fester and grow. Look at what may alter that defense mechanism. Delayed motility. Motility is movement. We like the movement. We like rapid movement. But delayed movement, from maybe the patient has a bowel obstruction, right? Maybe the patient's constipated, whatever is happening that's causing delayed motility, that can allow bacteria to grow and thrive, and we don't like that. Last, let's look at vagina. Right here, vagina. At puberty, normal flora causing vaginal secretions to achieve low pH. Remember, the lower the pH, the more what the environment, the more acidic the environment. Bacteria, pathogens do not like acidic environments. Okay, acid kills bacteria. So an enemy of this, guys, let me move this over. Antibiotics and oral contraceptives. Why? They kill the normal flora. Remember, you have normal flora down here. The normal flora is what keeps them in check. So you get rid of the normal flora, and you allowing a perfect opportunity for superinfection. This has been seen numerous times on both HESI and NCLEX. Matter of fact, also on ATI. Don't say I didn't warn you. Okay, guys, part 3, we're going to go over healthcare associated infections. If you haven't done so already, please go ahead, give me a thumbs up now. Subscribe to my channel if you have done so already. Be sure to check out everything that I have to offer on my website, nexusnursinginstitute.com. Guys, thank you so much for watching. You guys catch me on the next video.